Here's how you can assess your amalgam filling. First, smoothness. In the criteria, some surface roughness in some areas is allowed, yet you shouldn't be leaving any. And in order to get that, you need to run the enhance point manually all over the restoration to give you this nice smoothness. Second thing, material handling. There shouldn't be any clefts or voids, however minor ones, that do not affect the restoration integrity are okay. It's almost like the same as the first criterion of smoothness, because obviously if you have voids and clefts or some like a space somewhere that could affect your smoothness, as well as the second criterion, which is the porosities. Third, which also falls into the material handling category, debris. Make sure you have no debris available anywhere. So when you're done with your whole amalgam filling, make sure you thoroughly wash the tooth, the adjacent, the underneath, the gums, cheeks, elsewhere. Wash the whole jaw and mannequin to make sure you have no debris. Okay, the restoration integrity, of course, you get free 3 points for that criterion, because your amalgam should be there, so it didn't fall off or didn't break after you left it. What else? Tooth restoration junction. Probably this is very important. Your final amalgam should have a smooth transition between the cavus surface margin of the tooth, or the cavity, and your restoration. To check that, take any probe and run it from the tooth margin to the filling. In case you felt any catch, the probe is catching anywhere, it means you have some surface roughness, and even axially you should check that. Obviously interproximally you should be checking that with the floss, but I'm talking about the occlusal and axial walls. There shouldn't be any catch. Overhangs. How to check for overhangs? To check for overhangs, you should do that using the floss. If the floss passes and comes out clean, not threaded, then you don't have an overhang. If the floss, when it's removed, is threaded, it means you have an overhang. That's the way to detect them, which means you should take them away using the polish strips. Damage to adjacent or assessment tooth, there shouldn't be any damage. When can this damage happen? It can happen during carving, especially if you're using an abrasive instrument like the interproximal carver, or if you're using burrs for carving, which is definitely, ideally, shouldn't be done. However, you need to be mindful about the tooth margins, not to injure them. I mean the cavity, the margins of the tooth you're working with. Make sure you don't injure it during finishing or at any stage. Damage to the gums, obviously this can happen when you're putting and removing the matrix band and wedges, so be mindful and notice prior to start of the restoration in your exam, how is the condition of the gums, because if it were grossly distorted, then you might need to report them prior to start, so that you're not however, I believe they do scanning for the cusp before you start, before they give them to you anyway. Proximal contact tightness, a second major thing in amalgam fillings. First one is the no ditches, no catches at the margins. Thing number 2 is the proximal contact tightness. How to check for the tightness? When you need visually, the teeth should be in contact, right? No visible space. What else? How you can check? You can check using the floss. If the floss is making that nice tick sound, means you have the optimal contact tightness. All right? Alternatively, if the floss passes without resistance, it means you have a light contact. If the floss does not pass, it means you have a too tight contact that should be reduced. Proximal contact contour. The proximal contact should be ideally positioned from an occlusal gingival direction and from a buccolingual direction. So, however, proximal contact that is slightly broad or slightly too much occlusally or gingivally placed is okay. So what do we mean by that? The final position of the proximal contact, when you're looking at it from a lingual or a buccal view, should be placed at the junction of the middle and occlusal third. That's the gingival occlusal position. If it's placed too far gingivally, means you're gonna have an obliterated. The indication that you have placed the contact too far gingivally, which happens if you fail to wedge well, is that the gingival embrasure would be obliterated, would be smaller than normal if you compare it to the adjacent or the contralateral tooth. Okay. What do we mean when we say a shallow contact? A shallow contact happens when you have the occlusal contact placed too much occlusally, giving you a shallow contact, a wide embrasure, a wide gingival embrasure, and a contact that can be seen to be light somehow. That's what we mean by the contour from a gingival occlusal direction. But what do we mean when we say the contour from looking at it occlusally? We don't want a wide contact area, and we don't want a shallow creating a point. So ideally, there should be 3 buccal and lingual embrasure. It might be useful to compare that with the adjacent to find out whether you're getting a good and enough contact area width, or is it too wide, or is it too narrow, making a point contact, which we don't want, especially in the posterior teeth. The occlusal anatomy obviously should be optimal, resembling the original anatomy. For a 4-6 or 3-6, it should create the nice M shape, all right, with the lingual groove centered in the middle of the tooth, not shifted toward mesial or the distal, the central groove being in continuous with the adjacent teeth, so that it divides the tooth into 2 equal halves. And you should be able to duplicate other cusps, like the cusp curves and inclines, but don't overestimate the anatomy, because that's not the major point here. Regarding the lingual and buccal tooth contour, the restoration morphology should generally resemble the original anatomy, which means when we're replacing the mesiolingual cusp, the mesiolingual cusp tip should be in the optimal position in relation to the adjacent, to the distal lingual cusp, and as compared to the contralateral tooth. So the cusp tip is not being pushed too far lingual or too far labial. So this gives the nice contour for the buccal wall, for the lingual wall. If you're looking at it from the side, if you place the mirror from the side, it should give you the nice curvature, the nice contour. All right. So the wall shouldn't be straight at all. It should have a nice curvature. The cusp height, obviously, if it's under or over by 0.5 millimeters, should be fine, but more than that is not okay. Ideally, the mesiolingual cusp tip should be higher than the distolingual cusp tip. The cusp position, which we have talked about already, the cusp tip position should be placed in line with the other cusp, not being shifted too far lingually, not palatally, buccally. And you can get that by giving the nice contour of the lingual wall. You can reach that point. Regarding finally the marginal ridge height, ideally there should be at the same level with adjacent. You can check that by placing the mirror and check the marginal ridge height. It should be at the same height with adjacent. If it's higher, it should be lowered.